Hi everyone, my name is Dr. Erin Showalter. I'm part of the Grandview OBGYN group here at Grandview. I've been asked today to talk to you guys about cervical cancer screening, as January is Cervical Cancer Screening Awareness Month, or Cervical Cancer Awareness Month. This is important because worldwide, cervical cancer is actually a leading cause of female mortality. In the United States, we've been able to decrease that secondary to screening, and that is with pap smears. So what is a pap smear? Most females know what a pap smear is, but just so that everyone can be on the same page, a pap smear actually checks for two different things. It checks for abnormal cells on the cervix and the degree of abnormal cells on the cervix, and then it also checks for HPV. These are both important because we know that HPV and actually certain strands of HPV, high-risk strands, cause cervical cancer. This is different than things like breast cancer, uterine cancer, where there's usually a genetic link. Ovarian cancer is also typically genetically linked. Cervical cancer is different. We do know that there are certain people, like smokers, who have a higher risk of cervical cancer, and this is just due to the fact that these patients can't actually get rid of HPV as well as other patients can. How can we screen after we have pap smear? So if we know somebody has abnormal cells on the cervix, we can do further testing to actually diagnose cervical cancer, and that's typically done with something called a colposcopy, where we look very closely at the cervix and we're able to take biopsies. Another thing that can decrease the risk, like we talked about smoking, of cervical cancer is the HPV vaccine. And so this used to be recommended only to young women, but now it's actually recommended and able to be given to women ages 11 to 12 to age 45. Obviously it works better if it's given before exposure to HPV ever happens, so the younger that someone can be vaccinated, the better. Symptoms of cervical cancer, once it has been far progressed, are typically going to be bleeding with intercourse, pain after intercourse, pelvic pain, difficulty with urination. So if you're experiencing any of these symptoms, it is important for you to call your provider. And then cervical cancer screening in general is given to all women of all ages, especially up to age 65. So if this is you and you find yourself needing to be screened for cervical cancer, you can call your provider. If you do not have an OBGYN provider, you can certainly call me at Grandview OBGYN at 205-971-5499. Thanks for listening today.